Hello, everyone, and welcome to a very special day over here at the Maskell household, a very special day for the Rogue Health Economist, and hopefully a very special day for you if you're watching this. This is sort of a moment that I've envisioned for actually almost about a year now, and super excited to be here with you today. So for those of you who've been following along, my name is James Maskell. I've been involved in the transformation of healthcare through functional medicine for the last 10 years, or actually more like 15 years. And what I'm here today to share with you is a really exciting next step in my work, a new project that I've been working on, almost full time since January. But actually, the idea had come to me last year. It took a while to get all the pieces in place to be here. But if you enjoy what you're hearing, please share this message out with your community, because I want to tell you about something super exciting that we've been working on called Find Functional. And this project has a long sort of history to it of why we've come to it. And I want to share a little bit about that history. So when I first started working in natural health in 2005, I worked in a clinic, and then I moved to America. I worked in a clinic, and I moved up to the Northeast. I lived in Connecticut for a couple of years, and then I moved to New York. And when I moved to New York, I started to meet groups of people who were not involved with natural health at all, didn't know anything about it. And some of them had strange health complaints, right? Where they had things that were going on, and they kind of knew that I was involved in some sort of alternative medicine. And so they were interested in what I was up to. And they were like, hey, I've heard about this. And I would talk to them about different ideas, like getting to the root cause. I would talk to them about, holistic viewpoint. I was thinking about the difference between systems and function. And I was starting to go to conferences, and I get, pretty, started to learn these kind of things. And that was a moment that people would start to ask me, hey, who shall I go and see? Right? Which is the obvious question that people would start to ask me, because I'm involved in this world. And the number of people who have asked me which practitioner that I should see has been in the thousands over the last decade. And so at the beginning, my strategy was to send everyone to just the best doctor. And in New York, my understanding of who the best functional medicine doctor was at that time was Jeff Morrison. And I'd be like, Jeff Morrison, he's the man. He's reversing Lyme disease. He's got this amazing practice. It's beautiful. He was a customer of mine where I was working, and I was like, go and see Jeff Morrison. And I would send people to Jeff Morrison, and, I would start to get feedback. And, I would also send to other people in other parts of the country. And for some people, having a relationship with a doctor that listened to them, that understood their condition, that would really help to think, look, they're not crazy, these kind of things. That was an amazing moment for so many people to really understand, right? There was some sort of journey. One of the biggest things that I found that people are frustrated with medicine is that the doctor can't tell them why they became this way, right? How did you become sick? What happened in what order? One day you were okay, you had a few symptoms, and one day you've been diagnosed with lupus. What happened in that meantime? And going to a functional medicine doctor can be a huge eye-opener for people, because you start to really understand this timeline. What did your parents and grandparents do, and how did that affect your health? Then how were you birthed? Were you C-section? Did you come, through a normal birth? Then, from there, how many courses of antibiotics did you have before you were 6? And then, tell us about some symptoms that came up in childhood, and going through that whole process of self-discovery and learning your history and learning where you came from and understanding your experience from a different point of view, has been hugely valuable to so many people, right? That journey is really incredible. But for some people, they didn't have that experience at all. They experienced that this was really expensive. Why doesn't health insurance pay for this thing? Why is this guy trying to sell me supplements? Why is, there was all these issues coming up where people, felt like that there was something wrong with this process. And it was a mixed bag. And that was with the same practitioner, right? And then never mind now, this is happening now over the last 10 years, like a lot more people have asked me about practitioners from all over the country because we built the biggest, practitioner, conference with meetup groups across the country. And I drove this crazy bus across the country for 2 years and went to all these meetup groups. And I've been to hundreds of health conferences and functional medicine conferences. I met all these doctors, and we started the Functional Forum in New York. So tons of people ask me like, hey, who shall I go and see? And taking a step back, for some people it's an amazing experience. They're like, thank you, James. And then for some people it's kind of like, what was that? Like, why are you sending me to this doctor that, is trying to sell me supplements, or these lab tests aren't covered by insurance, or, they made me pay for a bunch of care up front. Like there was no expectation management system on the front, right? And that's what I started to see, is that people had mismatched expectations with the doctor. And I started to feel a little bit like scared to make recommendations to doctors, because I didn't know, like, would these be one of the people that had a great experience, or would these be one of the people that had like an iffy experience? So then I'm starting to work now with my business partner, Gabe Hoffman, who is a health coach. And he had worked as a health coach in a doctor's office in Long Island. And then he had actually started working in a center in New York. And, as I started to explaining this to him, and sharing that experience, he could really recognize it. And what we came to recognize was that, one, for something so new, like a really new experience, like going to a functional medicine doctor, like this is new for people. And therefore, there are some expectations that need to be communicated ahead of time as to what you're getting into. But also we started to think, was sending people to the best practitioner, was that the most important thing? Because some people only had a little bit of money. And we started to think about, like, how can we get the most people the most well for the least amount of money? And that wasn't investing in a $700 first appointment, because Gabe in his clinic would really work with people on the things that he saw that was really important, which is everyone has a list. Everyone has a list of the 10 things that destroy their health that they're still doing because they like doing them. So maybe it's drinking diet soda. Maybe it's watching lots of TV. Maybe it's not sleeping, 8 hours a night. Maybe it's being really stressed and not taking care of that. Like, it. If you're watching this, you know it, and I know it, and everyone knows it, that we're not all operating at the healthiest of our potential. And we have a combination of bad habits and other things that we do because, we like doing it. And so what Gabe said is, when he would work with patients, what people really needed, what most people really needed, right? Not the super chronically ill, I've been to every doctor, I've got Lyme, mold, SIRS, and heavy metal toxicity. No, not those people. But your average person on the street, right, they need accountability, right? It's nice for them to be heard, but they basically need accountability. They need someone to take them through these destructive behaviors and kind of like get into a little bit of them. Like, why are you still doing this? And, do you need some help? And how can I help you overcome them? And what are some little changes you can make? And, what are some switches that you can do from unhealthy things to healthy things? And that kind of thing. And ultimately, we started to realize that maybe it was better for me to send everyone to Gabe first, because his first appointment was $150, not $750. And ultimately, most people needed that sort of like accountability, friendship, guidance, advocacy, support, not like the full functional medicine workup. And look, it's nothing against functional medicine doctors, because they're doing amazing work. And if you put yourself in the mind of a functional medicine doctor for a minute, if all you're seeing all day is the most unhealthy people, like the sickest of the sick, come through your doors, of course you're going to start to set up your practice like, okay, anyone who comes in, we're putting them through all the tests. They're going to do the lab test, they're going to do the stool test, they're going to do the genetic test, because you want to get to uncover the root cause as quickly as possible. So I don't blame functional medicine doctors for that, because ultimately it's just reflecting to their own environment. Like, if you start getting a lot of the tiny, percentage of 1% of the sickest people out there, which is what functional medicine is, you really don't, you build your practice around that. And so what we want to see is like, if we wanted to help people get value for money, let's first send them to, you know, a much lower cost provider where you can really get into accountability and behavior change. And then if and only if you don't get better from that, which most people did, then we can send them for the deeper diagnostic testing, and we can send them for all of those things. And that's how we ran it for a couple of years. And this became the thinking that became the Functional Forum, and became the Evolution of Medicine, and became New Health, all the things that Gabe and I started together. And so, you know, ultimately last year, when it became clear that New Health was moving in the direction of being like sort of different from my original vision, and being like an insurance alternative, what we started to see is that like I wanted a place where I could send people where expectations would be managed, and where there would be a structure of helping people get the most healthy for the minimum possible cost. And I didn't see that anywhere. Like I didn't see that created. And I would see actually in some of the online groups that I'm on, like people saying, okay, who's the best doctor in, you know, I want someone who is in Atlanta, who is a hormone specialist, who takes my insurance and knows about Lyme disease. And I was like, oh my God, that is like an unbelievably specific ask, right? But you would get these kind of things. And I would be in groups where people say, hey, who's the best functional medicine doctor in Wisconsin? Who's the doctor who I should see? My friend needs to see one in Dallas. And I would, you know, I would field these calls because like I've been to all these places and I've been to all these conferences, and I know doctors who do great work. But have those doctors got an expectation management system in place, right? Have they got a health coach on staff? Are they running group visits? And then most importantly today is, do they have telemedicine, right? Are they actually open for business? Because a lot of functional medicine clinics today are not even open because, you know, most of primary care is out of business. We spoke about that last week. And so, you know, a lot of functional medicine practices, especially if you had like high overhead and a lot of staff, you know, you couldn't transition to telemedicine quickly enough to keep the doors open. So you're out of business today. And so, you know, before COVID went down, I was like, we need to build an expectation management system. Like I want to build somewhere where if I say, hey, go and use this service, we will use a combination of vetted functional medicine doctors, health coaches, and information delivery in a way that gets the most people the most well for the minimum amount of money. Like I want that. I want a service that I can send my friends to, knowing that no one's going to overspend, right? No one's going to be forced to get $1,000 of lab testing before they've even been told like, hey, you know, you're not sleeping more than 4 hours a day. Like, I think that's a problem. And I think maybe just try going to bed every day at 9 o'clock for a week and see what happens, and see if your health changes. You know, those kind of things. Like I wanted someone who would hold people accountable to lifestyle, right? The fundamentals. And also what I've seen, the best practices in functional medicine put the lifestyle first, because you know, if you're a doctor, that if you take someone who's doing none of the healthy behaviors and you have them over a period of time start to do the healthy behaviors, eat an anti-inflammatory diet, exercise and move regularly, sleep properly, deal with their stress, and have good relationships. If people do those 5 things, their lab test, their physiology, and therefore their lab test changes dramatically, right? And so is it really worth doing the $500 gut test on your first appointment if you do these healthy behaviors for a month, you may look completely different, and it might, you know, change what numbers come up there. And so ultimately, you know, I wanted to create something where I could send people to where I'd know that there was met expectations and where people could get the most healthy for the least amount of money. And that became a concept called Find Functional. And it's available today at findfunctional.com. Today is the launch. It's Cinco de Mayo. And I'm super excited to say that any of you who are listening to this right now, you can go to findfunctional.com. You can download one of the ebooks that I wrote. You can get a code from that email that we'll send you that will give you 50% off. And you can get started with functional medicine today for less than a copay. You can get started with functional medicine today for less than a copay, where you can start to go through a journey of understanding yourself, your history, your physiology. How did you get to a point where you have the symptoms that you have? what is the gap between optimal function and where you are today, and how can you close that gap, and how can you measure that gap? And so I'm super excited to be launching that, and launching it on the Rogue Health Economist podcast, because part of the reason why this is called the Rogue Health Economist is that, like, yes, I'm trained in economics, and yes, this whole thing that I've done is really about, changing the health trajectory, right? Flattening the curve of healthcare costs. And in order for us to flatten the curve of healthcare costs, we need to have these ideas of root cause resolution, lifestyle first. We need all these things that have an impact at the population level. And at this moment, functional medicine has had nowhere near that kind of impact. And I'm fully committed to that. And I spent the last 10 years, helping to build the army of functional medicine doctors and practitioners. And there's been a lot of people who have been helping in that way too. We have the Functional Medicine Health Coaching Academy. We have, organizations that have been training tons of people in this functional medicine operating system, so that ultimately we can have a common language by which to get people healthy. And so I'm super excited today to announce that Find Functional is live. You could join today for $49. You can get started on your functional medicine journey. Included in that is going to be an appointment with one of our health advocates. What's a health advocate? It's somewhere between a health coach and a patient advocate. Someone who can help you with implementing these healthy behaviors. Someone who can help to see where you are with them and see what healthy behaviors could you do that would make the biggest impact in your health today. You're also going to get a 2-week deep dive into the functional medicine operating system. You're going to get referrals of 3 functional medicine doctors in your state, in your area, who are available today via telemedicine, who you can go and see. It's a really big question that we would get all the time, like, who is that? And I've put together all of my favorite doctors into a database, and you'll get those recommendations. And you'll also get access to speak to your patient advocate for a couple of weeks to get you set up on your journey. Ultimately, our goal and our North Star at Find Functional is to get the most people healthy for the least possible cost. And, anything that we can do to help you get healthy. Some people, I've met some people who all they needed to know was the sort of fundamentals of, like, how stress leads to disease, or how lack of sleep leads to disease. And they just need to know that. If they know better, they can do better. And some people, they just need that information. Some people need accountability, right? And accountability to make changes over a period of time. I've shared many times that some of the biggest transformations of health that I've seen in people that I know is because of things like Overeaters Anonymous and Alcoholics Anonymous, like groups of supported people where you have an accountability buddy, where now you're paired up with someone and you just share what you're doing. Like, we want to take advantage of the power of community. I wrote the book, the Community Cure, and it came out in January, really all about making functional medicine affordable and accessible through group visits. Well, no group visits are available right now because you can't even be in a room with 12 different people. And so one of the things that we're going to be offering at Find Functional is virtual group visits. We're going to introduce people who want to get healthy to each other and create a new community for them to be together. And so at the beginning of next month, we're going to be launching our Immune Collaborative. It's a multi-month program that includes time with your health advocate. It includes meeting other people that are trying to get healthy just like you. And it includes content and information to help you build, to make you hard to kill, right? If this virus or other virus is going to get to you, how can you make sure that you're in the 80% of people that have absolutely no reaction to the virus versus, the smaller percentage of people that get an infection or die, right? The difference between those people is function. And ultimately, we can help you build function by building the fundamentals of health creation, understanding yourself, going on a journey of self-discovery. So I'm super excited for everyone who's watching this to go and check it out. It's findfunctional.com. You can go there, you can download the ebook, you can get started. I'm not sure, we're not sure where this project is headed, but I really hope that there are people out there that maybe you've tried going to a practitioner and you felt let down. Maybe you've never heard of functional medicine, but the price tag has put you off and you've never had a chance to go there. Maybe, you've had some interaction with it and you haven't got the results you expected. Or maybe some of it just doesn't make sense to you because you haven't thought about the body in that way. We've got incredible interviews with, we've got resources. You're going to go through a process of understanding your unique triggers. Like, what are the things that triggered your poor health? And I'm super excited for, hopefully hundreds, thousands, tens of thousands, and maybe millions of people to start on this journey of self-discovery. So thanks for being with me. This has been the 7th episode of the Rogue Health Economist. I'm a Rogue Health Economist because I'm not just sitting and telling people like the economics of the situation. I'm hopefully creating structures and systems that can help people get better for the minimum possible cost. Extricate yourself from the medical system. Live happy, healthy lives like they do in the blue zones until you're 90 or 100 years of age. That's the vision of what we're doing. That's the goal of Find Functional. That's available to everyone now through findfunctional.com. So please check it out, visit, download the ebook, get your code, get started. For $49, you can get started with functional medicine for less than a copay. Super excited to hear your feedback. Happy to take any questions here. If you're on the live stream, drop us any questions right now. Otherwise, you can leave questions in here below. Thank you for hearing me out. It's been an incredible journey thus far, and I know we're just getting started. I know that many of you have lost the potential of accessing functional medicine because maybe the clinic close to you or the clinic you've been working with is currently furloughed. And, our goal is really to be able to make functional medicine available, accessible for anyone. So thanks so much for listening. Thanks for being on the Rogue Health Economist live show. It's been great being with you. Check out findfunctional.com. Thanks so much for watching, and we'll see you next time.